Okay, we're here live, and we have Dave from NYC Pain MD. He's back again, and we're going to talk about some great stuff. One thing we really want to talk about is we've been getting a ton of questions, emails, and stuff. These guys are real medical doctors there, and they're treating a lot of pain stuff. They're treating a lot of back pain, knee pain, headaches, all different kinds of stuff, shoulder pain, hip pain, and they allow people to come in for a free screening. And people want to really know what this free screening is, what they get, what they can expect, what happens that day when they first come in. And so Dave is here today, and he's the new patient coordinator there. He's the expert of getting in new patients and walking them through. And he's gonna explain what this free screening is, what it is you actually get, and what you can expect that first day. So Dave, you're here?
Yeah, I'm here. Hey, thanks for having me. I guess we had a little hiatus with the summer, and so we haven't been doing our kind of mini patient education meetings, but it's good to be back. And you brought up, I wouldn't call it an issue, but I guess anytime someone starts with a new doctor, they have a problem, there's always that, what's it going to be like? And frankly, when you're in a lot of pain or you have a health problem, sometimes it's real scary. You know, one of the things we hear with our knee and back pain patients, like they do not want to have surgery. And that's really our niche. We're trying to keep people out of surgery, give them the most conservative approaches and get them feeling better and back moving again. So in regard to what happens is if a patient calls our scheduling hotline, our patient information center, they're going to have a lovely person who asks them just a couple questions to make sure we're the right facility. Once we find a good time for you to come in, you're going to see a lovely office. We're working on doing an office video tour, as you and I have talked about. And they're just going to fill out a little paperwork. So we have a background, the basics, and then they're going to see a screening doctor. That doc is going to walk them through all the various options of care. They're going to ask them a lot of questions about their health history, the history of the area of pain. Say we're talking about knees, what they can do, what they can't do, how it's impairing their life, how they can't move, their loss of mobility. And they're going to do a brief screening evaluation and then most likely take an x-ray if the patient doesn't have a recent one. That'll let the other doctors know exactly what's going on inside that area. After that, they're going to be guided down to the procedure doctor who's going to do a second opinion and final opinion in the office. They're going to look at those x-rays in detail. They're going to explain everything precisely to the patient, what's going on with their particular problem. Now, frankly, Brad, there's cases that we do not accept. They waited too long and we can't help them. But they're going to get some direction on what they should do and who can help them. We'll set up appointments, give them phone numbers, guide them to the right specialist. Maybe they're from out of the area, etc. But if the patient is an acceptable candidate, there may be a couple different options. There may be several programs that be needed to be done. The doctor is going to explain them in detail, in simple terms, so you understand them, not doctor talk. Very friendly, it's very easygoing, but it's very detailed and the doctor very skilled. And then after that, you're going to see your x-ray. They'll explain the damage, they'll explain the exam findings, and you're going to understand your condition. Based on that, the doctor will then lay out in simple terms the proper treatment regimen that should be attempted. At that point, the patient can ask as many questions as they want, so they get a perfect understanding. And then, here's the most important part. Not only is the screening at no cost to the patient, there's absolutely no obligation. Once a patient gets the information, they're going to be able to proceed exactly as they'd like. There's no stress. There's no pressure at all. In fact, the doctor's so busy, that's about the last thing you're going to feel when you come in to see our guys. Here's probably the most important point. You and I have discussed this in the past. What patients really need is direction. And this is what they're not getting from the medical community. All they hear from a surgeon is, yeah, you need a knee replacement, or they'll go to their primary doc and they'll give them a bunch of pills, which are toxic. And you know all about the oxycodone and the opioid epidemic now, and people don't want to go there. But they are going to get direction. They're going to have guidance. They're just going to feel better having someone to talk to that's completely on their side, and is going to give them the best options to try before going into surgery or, getting on into that drug route. And I think that's the key to it. And that's why patients are so comfortable. And probably for every single patient that comes in, immediately 2 or 3 of their friends call because they want to find out about their own problems. And whether it's their knee, their back, their shoulder, their hip, their headaches, etc. So I think that's a synopsis of why that first visit with us is so important. And that it's going to be comfortable, it's going to be easygoing, you'll feel at home, and there's no fear at all. There's nothing to be uncomfortable about.
I think a lot of people, and I've had back pain, and I've hurt my knee and everything. And part of the fear is the unknown. You don't know what happened. You don't know how bad it is. And sometimes you put things off and you don't want to go, and you really don't want to know how bad things are, but, and then there's that fear of going into a medical facility of doctors that you don't know, and they're going to examine you. And it's this big thing. And then also you go in there and you don't know if you're going to be sold things, and lectured and stuff like that. The biggest thing here is that you guys are going to take away that uncertainty, take away the fears. People can come in and they can finally find out what's wrong with them and then have the proper path mapped out for them. Even if it's not something you guys there treat, you're going to head them. You're going to say, hey, look, you have X, you have this here. And I think the best option for you is to go see someone else. If you guys can treat them, they're great. If you can't, you're gonna point them to the right doctor, and that's a huge thing. And just when people know that what's wrong with them and what can be done, and what's the best options, not just options, the best stuff. You guys know about stem cell, PRP, radio frequency and stuff, and you can talk about this stuff in a little bit. But you guys are doing cutting edge medical treatments there. So you guys are not only doing the best stuff there, but you guys know about the best stuff. So you guys can really point them in the right direction. People are going to leave there breathing a big sigh of relief and say, hey, I finally know what's going on here. Most of the time, it's not as bad as everyone thinks it is. And there's ways to take care of this, right?
Right. Well, I would agree with everything you said. And that breathing a sigh of relief, that you're going to know that you are got a very thorough evaluation, and you are going to feel that someone understands and has all the tools in their toolkit, the knowledge, the skills, the experience. And certainly if they can't help, they're going to direct you in the right direction. So there are people that have waited so darn long, Brad, that, they've gone past the point where we can do anything. That's the idea of the screening. One of the reasons we decided to do it at no cost, because we don't want to have any barriers. We want it as a community service. So if you're concerned there's a problem, you're going to come in. You're not going to feel stressed. You can trust the staff. And, you want to walk away and do nothing no matter what the doctor recommends. That's fine with us. It's really very common for patients to come in, get an eval, get a recommendation, and not show up for a month or two when they actually think about it. So they move at their own pace. And but you are correct. We have all these tools under one roof. There's many different treatments, what we call non-surgical orthopedics, sometimes called orthobiologics, etc. We do it with the most high-tech precision arthritis targeting, whichever joint it is. And so if that's what you need, we'll tell you. If you want it, great, we'll set it up. If you want to think about it, of course, it's perfectly fine. It's very, as my teenage son says, it's very chill. It's a very calm atmosphere while it's very busy. You're going to feel much more relaxed about your condition, and you're going to know that there's some hope in getting your problem finally solved and getting that mobility back, which you've lost, and all those fears of ending up in surgery and months of rehab and dramatic expensive costs and so forth. So I think you hit the nail on the head with what you said just before.
Yeah, and you're talking about, just so the people listening here are kind of clear, what kind of conditions do you guys treat there?
So basically in an office like ours, because we treat what's called neuromusculoskeletal pain, these are orthopedic type conditions, muscles, joints, arthritis, neuropathy, herniated discs in the neck and back, headaches and migraines, hip problems, ankle problems. Here's an interesting one off topic. A lot of people that have knee pain, we'll get their knee evaluated, and this is real. There's not a thing wrong with their knee, but guess what? Their hip is a mess. So the hip on that side can radiate pain to the knee, and they don't even know it's coming from the hip. So when we have to work on the hip, so you know, you have to. The docs are very good diagnosticians. They know what they're doing, and so any of those conditions, there are options for that are out of the surgical realm. And frankly, this sort of loosey-goosey thing that the medical world has with prescribing painkillers. And you know what? I've been saying it for years, and now it's become an epidemic. You cannot open a newspaper on any given day or week without someone talking about the opioid crisis. And now there's a massive lawsuits against the drug companies and all the people that are prescribing it, because people get hooked because these other doctors didn't offer them these other conservative approaches. And not that the doctors weren't well-meaning, but maybe they didn't have the training. Maybe they started before these techniques were available. Maybe the patient didn't know about it. But that's the idea, going back to the free screening. It's an opportunity to find out. And you have everything to gain and not a thing to lose, except about 90 minutes of your time.
Yeah, so, I always say that, you know, we only know what we know, and we judge everything by the limited information we know. You know, and a lot of people out there don't know that these treatments that you guys do exist. And some doctors out there, they don't really know with the level of expertise that you guys are doing these things with. It's incredible.
Right. What's very interesting, and this has been happening for a good year or two, about every other patient is referred by the hospital or another doctor. We don't even know these people, but they've heard about our treatments. And frankly, you know, you go into your primary doc, they don't really know what to do for you anymore. They don't really want to keep giving you these pills. Patients go to, say, the therapist, and it often doesn't work, or it aggravates. And they're left with the patient crying because they don't want to go get a joint replacement or some sort of surgery. And so they started hearing about our approaches, and you know, that's about half our patients are in that direction now. So what they're starting to realize, exactly what you said. Some of the docs realize that they don't know a lot of stuff, but they're reaching out for someone that does have that expertise, rather than just carting them off to the surgeon, who inevitably is, I think, a little too aggressive with the surgeries. There's a lot of data on that, saying that 1 out of 3 joint replacements may be unnecessary, maybe even more. They're being done to younger and younger patients. So it's a good idea, in my opinion, for patients to find out about all the options, and you just get the information. You settle it in your own mind. You can talk about it with your family. Then you make a decision what you think is best for you.
Yeah, it's really just information. You come in and like you said, like your son said, it's chill, you know, and people can hear us now, and they can listen to all of our webinars and stuff like that, and we're really laid back. And NYC Pain MD, it's more of a laid back place where people there, you know, they're real doctors, experts, but it was really, you know, built for the average person to come in and get the information they need, and if they're a match, to get the best treatments available. And it's not this hospital, a big sterile place. It's really more like a throwback to the days when doctors were personable and patients weren't just a number. You know what I mean?
Right.
And they can come in and they can get that personal care, but you also have the best technology available today.
Right. I mean, you know, and going to a hospital for, like, to their pain management departments, if you want to call them that, or their rehab, it's like going to like a major home goods store to buy a screwdriver. You have to go through 100 aisles and this huge thing. It's very stressful. It's not a private setting. There's a million people that you get lost in the shuffle. And frankly, to be honest, their fees are 2, 3, and 4 times as high as ours, because they charge all these facility fees that are, I believe, unnecessary, especially with all this talk about lowering healthcare costs. You know, we never charge a facility fee when we see a patient. There's no such cost. The office is the facility. We have 3 or 4 procedure rooms. They're all in one, and so it's a better experience.
Yeah,
overall.
I've had a lot of people come, they've said to me, "Hey, I've heard your guys' stuff and I would really love to go, but I know procedures like that, like them cell and this and that, they're $8,000 or they're $6,000 stuff because they've gone out and priced them at hospitals or places like that. And you guys are doing stuff and you don't charge as much, and there's a reason for that,
Right. Well, it's gotta be, I remember learning back in some business courses that Henry Ford, when he started the Ford Motor Company, whatever you think about Ford, is that he wanted to try to make his vehicles affordable to the average person. And he paid his workers in a way that they could actually afford a car. So obviously, if it was up to me personally, I wish I never had to go to a doctor. But when I have to, I want it to be a good experience, and I want it to be, fairly priced. I mean, there's one hospital uptown from us, and they literally charge about 3 to 4 times for a platelet-rich plasma treatment, just because they have the name. It's crazy. I don't know how patients. In fact, I met one of their head doctors there, and he said, the fees they're making us charge are so high that I couldn't even afford to be a patient here. And that's a quote directly. That's the exact words he used. So, we're trying to look at all the angles from a patient's point of view, and give them the options, and make it a great place to get treated if they happen to need it, and make it fairly priced. It's not just for the rich and famous, as we say.
Yeah, and what I always tell these people who question me is, man, the screening is free. Go in, check it out. You're probably going to be surprised at the great information that and they'll tell you what this all entails. But you're probably going to be surprised. It's not as expensive as you think it is. Go in, it's free, check it out. If you don't want it, don't do it. They're not going to get a sales pitch and this and that, but at least you're going to get the information. You're going to know what's wrong with you and what road you should take. And if you still choose not to do it, it's fine. But having that information really gives you that peace of mind. Like, man, this isn't as bad as I once thought. There is something I can do here. And that's just a huge thing. And people go home and they can actually sleep at night finally,
Yeah,
and say, hey, what I mean?
People and even some of the old timers, if you want to call it, in medicine, they take a while to grab onto these things, and then finally they go, wow, that stuff really works. And here's something that so many patients have said to me personally. Hey, I wish I knew about you guys before. I've been hurting for so long. I'm feeling better. I wish I didn't let my joint, my back, my shoulder, my hip get so bad to start. And I said, hey, that's why, we let other doctors know, and we put articles in the paper, and we go on TV, and we do these, mini webinars, so people finally find out. But so that's the whole purpose of it. Now, I know you're going to put a phone number up. It happens to be 877-380-8520. You can call directly to the office. And by the way, Brad, sometimes we get over 100 calls in a day, so our staff can't even get to all the calls. And that's a low number. So if you get a voicemail and you call that number, and I think you're going to be able to put it up on the screen, leave a message when we can get back to you, and we will normally get back to you within 24 hours, if not by the end of the day. So make sure you do that, because we can't help you if we can't talk to you about, setting up a screening appointment.